Lexicomp's Patient ERX tool is designed to enhance medication safety and provide an efficient means to manage patient medications. With Patient ERX, dental professionals can review a patient's saved medication history, prescribe medications electronically, receive patient safety alerts regarding drug interactions, provide allergy warnings, as well as assess patient insurance information. To access the Patient ERX tool, click the Patient ERX button on the blue toolbar near the top of the screen. This will launch the login screen for the DoseSpot Patient ERX module where you enter your username and password. To begin, you can either add a new patient or see a list of your previous patients. You'll only have to enter information about your patients once. Select a patient to access the stored patient record. As you can see, all the patient information from the last visit is displayed. The next step is to enter any patient-reported allergies. In this case, the patient explains he is allergic to penicillin because it gives him a rash. Add penicillin as a drug class, set the status as active, the type of reaction as rash, and when the patient began noticing symptoms. This information will be saved in his patient profile, and you will be alerted if you try to prescribe a medication that will cause an allergic reaction. If you return to the patient's details, you can automatically view the patient's insurance information, including his eligibility for retail and mail-order pharmacies. With Patient ERX, you can view the patient's entire medication history, which will include medications other physicians and dentists have prescribed. This information is pulled directly from insurance companies and pharmacies in real time. While reviewing a patient's medication history, you can quickly add any patient self-reported medications by clicking the Add Patient Reported button. For example, on the health history form, the patient indicates they are taking Lipitor, Ambien, and warfarin. Quickly add medications by simply typing in the first few letters of the drug, and the remainder of the drug name will automatically populate. This medication will then be marked with a comment indicating that it is self-reported. Also, while reviewing the medication history, you can ask if the patient is still taking medications, such as dicyclomine. If they are no longer taking the drug, simply remove it from the active medication list. After you have reviewed the patient's medication history, click Add New Prescription to select a medication and send a prescription electronically to the patient's pharmacy. Let's say you want to prescribe amoxicillin. This will display all the legal dosage forms of the drug and allow you to enter dispensing instructions. Finally, you can review the formulary to make sure the patient's insurance covers this drug. In order to ensure medication safety, the system automatically checks for medication alerts and drug and allergy interactions. Clicking Dental Alerts provides a summary of how a patient's medications may influence dental treatment. The Drug Allergies Alert notifies you that the patient is allergic to amoxicillin. Clicking the Interactions link will provide more detailed information about the interaction. However, we understand that the dentist knows best and will never prevent him or her from prescribing a medication. These warnings are meant only to support your medication decisions. Once you check the box beside the medication and click on Approve and Send, the prescription will be sent directly to the patient's pharmacy. Use Lexicomp's Patient ERX module to maintain medication safety, efficiently keep a record of your patient's medication history, and conveniently send prescriptions to your patient's pharmacy of choice.